And I've worked in senior housing in the state of Maryland for almost 30 years. And just love what we're doing, which is why I came to the Maryland Department of Aging. I have Julia here, who is my support and also my co-worker, and we're great partners and working stuff with Maryland Department of Aging. So Julia, you want to just kind of quickly introduce yourself and tell them, get any of the housekeeping stuff over?
Yes. So glad to be here and very nice to meet you all. I'm Julia Schreiber. I am a program manager here at the Maryland Department of Aging, and I work on a few different programs related to helping people navigate Medicare. So if you happen to be familiar, it's the State Health Insurance Assistance Program. Just in terms of a little bit of housekeeping, I know quite a few people were having some challenges getting access to the resource packet and or the drive. If you are not able to access either, please send me an email. It may be that the workaround is that you share a personal email address if you're willing to and happen to have a Gmail. Sometimes there are some security restrictions between the two organizations, and having a personal email will resolve that. So please just feel free to reach out.
All right, great. Great. And so the chair of our group is Mavis. She is here with us. She helps keep me organized and is going to help kind of run because I can get to monologuing and then we'll be stuck here. So she keeps me moving along and helps us, because this is, I said, an Open Meetings Act. It is being recorded. It is being live streamed. We do kind of have a backdoor proxy that we could watch if there was anyone in the public who was to want to make comments. We'll be able to see that, and we could deal with that. We want you, because you are members, to come to the meeting through the link. That'll give us, the visual and being able to talk with each other. But because of the public coming in, they wouldn't necessarily be able to comment. Just in case, right? We're just, we have things to get accomplished, but certainly this is a public meeting, and we do want everyone to know the recording will be posted. So if you miss a meeting, don't worry, you can catch up. It will be posted no later than probably 4, 5, 6 days after this is up. We will have the minutes. That's something Mavis is happening. We do have the recording going, and we do have, and JJ, now that I'm looking, do we have our AI on that is translating everything?
No.
And don't we need that?
Translating? No, transcription is being taken at the moment.
All right. The wrong trans part. Transcription is what I was looking for, because it will send us these meeting notes. So we can be very professional here. So, all right. That is on, and so we're going to do that. But Mavis, I will turn it over to you to introduce yourself.
Hello, everyone. My name is Mahvesh, and I will be chairing the Promoting Economic Opportunity Group work group. And for my background, I have been associated with promoting different activities within my own community for the elderly. And I have worked in the healthcare in some of the private hospitals here in Maryland in nursing administration. And currently I'm associated with a religious nonprofit developing different opportunities for the elderly, as well as conducting different activities for them. Thank you.
Thank you. All right, we will get started. So we are going to take some time just to introduce yourself. Tell us one thing that brought you to this group, so that we can kind of get to know each other. I am then going to spend a little time more explaining what Longevity Ready Maryland is and where do we fall, because it's, as I said, a little complicated. And I will kind of outline what we want to get accomplished. We have a short period of time to accomplish a lot. I rest assure you, though, the biggest part of what Longevity Ready Maryland is to take the experts that you guys are, the groups that you've probably been working on for years now. Let's get this information together. Let's comprise it to start this plan that we can be better prepared for all of our older Marylanders over the next 10 years. So we're not here to solve everything right away, but to put a plan together, a step 1, a step 2, a step 3. So I know a lot of people had talked about, wow, that's a really short period of time. Again, it's going to take us a long time, and you can make things so long that you get nothing accomplished. A lot of groups have been working for years now. Let's bring that information to this platform. Let's put it together. So we have a short period of time, but a lot of the work has already been done. But for right now, you've met us, and I'm going to let Mavish kind of run us, that she will call on you, that you could please introduce yourself and tell us one thing about you. Why, what do you bring to this group? Why did you come to this group? And so we look forward to kind of getting to know. I see so many faces that I know, but so many I don't. So I'm looking forward to really meeting everybody. So Mavish, I'll let you get started.
Okay, thank you, Ms. Leslie. So let's get started, and we can start with Bisma.
You're on mute. There you go.
On mute. Good morning, everyone. I am, by profession, I was a doctor, physician in women's health, OBGYN. So, but I hold MD degree. I'm not currently I'm not in a clinical practice, but I chose to transition my career trajectory to public health, because I felt like through public health, we can treat the masses, treat and manage the masses. And that was the mantra or motto of my Bloomberg Johns Hopkins Public School as well, when I did my Master's of Public Health, and I fell in love with that treating millions at a time. So through policy and through such work groups, and through, community engagement and involvement for the benefit of population. So I am currently, I have, mixed experience of, you can say, clinical health, program development, and public health, population health as well. So after working with the Baltimore City Health Department and other local and state agencies, finally I chose my current position. I'm working with the Department of Public Safety and Corrections, Department of Corrections in specific for Maryland, as through Centurion. Now my company, they won a $1.7 billion project just recently in August. Before that, I was working for JustCare and Corizon, but we know the political, we know all this, like how this healthcare system works. So Centurion took over in August, and I have been working with the female prison system, and where I developed women's health education program for the huge population, 800 women. And I have I've been wearing multiple hats. I developed the program. I wrote the curriculum for women's health, reproductive, and menopausal health. So here comes the aging population that is very dear to me. And I have seen firsthand the social determinants of health through life course perspective. And that's what I think we are going to accomplish here, how we can improve all that. So wrote the curriculum, developed the program, implemented the program, and very successfully, I am facilitating now 6 to 9 classes, like educating them, first-hand experience working with the Baltimore City Health, Baltimore City populations and all the women. So that's my main goal. Yes, that's my goal now, to help Maryland Department of Health in any ways I could do, because we need to be ready, and we need to be ready for our perimenopausal, menopausal, and economic issues. So that's where I am.
Well, wonderful. Thank you to the group. You certainly bring a lot. Thank you so much.
Appreciate that.
Thank you, Bisma. Let's hear from Carolee. Carolee Silka.
Good morning, everybody. I'm Carolee Silka. I am the director of the Area Agency on Aging in Allegheny County, Maryland. I've been in my position I celebrated my 1-year anniversary yesterday, so I've been in this position now for a year. My goal for participating in this group is just to learn as much as I can about the program so that I can be a good steward in this part of the state.
Thank you, Carolee. Let's hear from Kathy.
Good morning. I'm Kathy Nestoriak. I'm with the Jewish Council for the Aging. I'm the Director of Job Seeking Services and Training here in Montgomery County and Frederick County. I am so excited about this group because I'm excited to see what other folks are doing across this county and state to help support our older job seekers. A little bit about me. We run two different programs here. Well, we run several programs at JCA, but I run two. We run the Senior Community Service Employment Program, which is minimum wage stipend training for older job seekers to return to work, to gain skills and to retrain. We also run upskill job training, which helps hands-on training for older job seekers to make sure that their skills are current and they can navigate the new world of job seeking. So we've created that program here at JCA. So I'm excited to be part of this and hear what everybody else is doing and learn what is ahead for the state, because our older workers are our future.
Yeah,
as we
we're
get it.
We're going to need you, Kathy, on our subgroup on the 50 plus. So I'm really delighted to have you. So thank you so much.
Happy to be there.
Good. Thank you. Welcome.
Thank you, Kathy. Let's hear
Thank
from
you.
Shania. Shania Fabius.
Good morning, everyone. My name is Shani Fabius. I'm an assistant professor at Johns Hopkins University in the School of Public Health in the Department of Health Policy and Management. I am a former care manager for the Connecticut Home Care Program for Elders, turned researcher, and my research focuses on addressing issues of inequities related to inequities for older adults, family caregivers, and the direct care workforce, all of whom are impacted by long-term services and support. So I've been doing work in Maryland for the last couple of years, both survey work of residential service agencies and qualitative interviews to understand more about supports for the direct care workforce, especially as it relates to the care of people living with dementia. Happy to be here, and thank you.
Thank you. Let's hear from Diane.
Hi, good morning, everyone. My name is Diane Martin. I'm an associate professor of gerontology at the University of Maryland in Baltimore, and I also am the director for the university's Geriatrics and Gerontology Education and Research Program. We call it the GGEAR program, and it's a program that dates back to 1987 as an initiative that was brought forth by then Governor of Maryland, Harry Hughes, and the Chancellor of the University of Maryland, Baltimore, Edward Brandt, who was chairman of the Governor's Planning Committee on Geriatrics and Gerontology. So you can see the university has a longstanding commitment to an educated workforce in support of an aging society. I am a gerontologist, and I think my expertise in gerontology and aging is really important to this work group because we're going to be formulating these strategies that address critical issues such as employment, caregiving, workforce development. And these are all areas where my knowledge and experience can have a significant impact in helping to design initiatives that foster economic opportunities and personal fulfillment for all age groups and improve quality of life. This work group also aligns with my longstanding commitment to education and training of students and professionals who either will be working or currently are working on behalf of older adults and their families. As director of the GGEAR program, my work is really focused on the importance of equipping the next generation of professionals with the skills they need to meet the challenges of an aging society. So I'm a strong advocate for initiatives that support caregivers, promote workforce development, and create pathways for older adults to remain engaged, because that is such a high part of quality of life, regardless of whatever chronic health conditions the person's managing. We need to have a high quality of life. So it could be through continued employment, through volunteerism, or other meaningful activities. These all can help ensure that older adults remain an integral part of society. I think it's important to keep older adults involved in the workforce. You know, so often we're thinking about the caregivers only, but we need to be thinking about finding meaningful opportunities for people as they age as well to keep them engaged. So whether it's through paid work or through volunteerism, they need to be able to continue to have opportunities where they can contribute their skills and experiences and also strengthen social ties that enriches our broader community. So through my involvement in this work group, I can advocate for policies and practices that promote personal fulfillment and societal inclusion for populations, with the goal that Maryland is not ready just for an aging population, but that it thrives as a state where all generations can contribute and benefit. Thank you.
Well, it's wonderful. Nice to meet you, Dan. I think we exchanged a few emails, so it's nice to meet you. And
Yeah, you too.
And it's okay with the acronyms because, you know, as a state, we love these acronyms, right? I swear.
Right.
Nice to meet you. Welcome.
Thank you, Diane. Let's hear from Chase.
Hi, everyone. My name is Chase Mulholland Green. I'm the policy coordinator at Johns Hopkins University. I work very closely with Cheney Fabius and other researchers with the Lipitz and Head Center, focused primarily on aging-related policy, and the Head Center focusing more on Alzheimer's and dementia-related policy and research. And I'm here really to help support the Direct Care Workforce Work Group. I'm very excited about this. My background is in tech, supporting SNFs and other post-acute facilities. So really care about this population and excited to meet you all. Thank you so much.
We are excited to have you, Chase. Thank you. Let's hear from Dora.
Hello, I'm Dora Berg. I'm the Financial Wellness Associate at the Associated Jewish Federation of Baltimore. My role focuses mostly on financial health and our financial health services, but that of course has a lot of overlap with the aging community and also our disability inclusion work as well. I started here a little bit over a year ago after finishing my MPH, and the Associated is an agency system. So my role is to think about how we can best coordinate our services so they're as efficient for the community and as accessible to the community as possible. So really thinking about that systems level response. And I'm excited to be here and to learn about the work everyone else is doing and the resources available across Maryland. And I'm excited to see what we all can come up with.
Wonderful. Welcome, Dora.
Thank you, Dora. Let's hear from Elizabeth.
Best to turn on the microphone and camera too. Well, thank you so much. I'm very proud to be part of this endeavor, to really think thoughtfully about Maryland citizens over the next 10, 20, 30, 50 years, to be able to think about policy and how we can shift and make this state even more senior friendly. I've been part of the fabric of home care and caregiving services and working with seniors for probably about 40 decades. Our company, the Elizabeth Cooney Care Network, provides caregiving services across the state of Maryland. We've been doing this now for 67 years, taking care of generations. We've seen everything from political changes to social and economic impacts, what that does to the caregiving, the workforce. I also had the honor of being able to create the Certified Nursing Assistant Program for the state of Maryland and sat as its chair in the Maryland Board of Nursing for a very long time, creating the regulatory, education, disciplinary, and platform to be able to allow CNAs to thrive. But that's just one leg. There are many different ways to be able to support our workforce. And I think I'm very excited to think thoughtfully with this entire group to think how can we best allow caregiving, paid and non-paid caregiving, to be able to thrive. I also was chair of the Maryland Caregivers Coordinating Council before it became a commission for about 10 years. And I also sat as the chair of the Maryland Respite Care Coalition as well. And I also sat as the president of the United Seniors of Maryland, which represented about 1 million seniors. So advocacy is an essential part. And I think everyone here knows that, and that's why they're participating. But I think the good part is that we have a fabulous secretary and a department that's open to new change and actually to create pathways. And that's what I'm probably most excited about. And I look forward to participating with each and every one of you. Thank you.
Wonderful. Welcome.
Thank you, Elizabeth. Let's hear from James.
Good morning, BJ Goldman. I am the chair of the Greater Baltimore HIV Health Services Planning Council and a person with 40 years of lived experience. The reason why I got involved with this group is to ensure that the voice of people with HIV is reflected in any future plan for the state of Maryland. Thank you.
Thank you,
James. Thanks for being with us.
Thank you. Let's hear from Josephine.
Good morning, everyone. I'm Josephine Cabay, Maryland Department of Labor CSEP Program Manager, and I'm really excited to be part of this group. I'm looking forward to learning what everyone does and how we can all interact and bring to the surface what we can do for seniors here in Maryland. I've worked with, over the years, participants who they just want to get back into the workforce. They need the training, which we provide by our host agencies. They want to be back into the community and part of the workforce. So I'm real excited about this. I want to see what we can do to bring the economic improvements back to Maryland for our seniors. I feel like this might be an open door, so I'm looking forward to it. Thank you very much.
Well, I look forward to you teaching us more about CSEP because it kind of is our little subgroup already, right? So it's a perfect blend. So I'm so glad you're in our group. So thank you, Josephine.
Thank you.
Thank you. Let's hear from Karen.
I'm really happy to go after CSEP because we love CSEP here in Harford County. And you guys help us expand our capacity because we do utilize CSEP staff, and it makes a great difference. It's also really nice for our seniors to have seniors be the first person that answers the phone to reach out for services and supports. I'm Karen Winkowski. I'm the administrator for Harford County Office on Aging, where I've been the AAA director, Area Agency on Aging director for 17 years. Prior to that, I was the clinical director of a drug treatment program in a health department elsewhere in Maryland. So a long history of public service and supports to communities in need. And, we are confronted every day with economic needs from our senior community that range from housing to transportation to food insecurity to healthcare costs to seeking post-retirement employment. And it is a crushing need for those that we serve. And it is, as I said, a crushing need right now. And unless there is intervention and planning, this will not get better. So I am pleased to be on this work group for that reason. We have to plan to bring hands together and make this lighter work. And this isn't anything any jurisdiction can do on their own. So I'm pleased that the state has taken the initiative to move this forward, and very pleased to be on the group.
Thank you, Karen. We are very excited to have you.
And I will just share, Karen is one of our best AAAs, as is Carolee. And so I was glad to grab them on our group, but Karen, we made her get on like other groups too, because she is such a great advocate. So Karen, thank you for taking these dual groups on. So your insight is what we need and wanted. So thank you.
Thank you.
Mhm.
Let's hear from Mary.
Good morning, everybody. Great to be here. I am an engagement officer statewide for older Marylanders on behalf of Brooke Learman, Comptroller. And it's been really a pleasure to be in the Comptroller's office for the past year because she is so committed to making sure that all Marylanders have all the information and resources they need to thrive economically. You think everyone in the workforce, okay, we have this workforce. Who wants to talk about taxes and how does that affect everyone? Well, I've learned so much and I'm so excited to be able to share the many resources and assistance that I think people just don't know about that can truly help them economically, from tax credits to free information assistance, free tax preparation, and more. So I'm happy to be on this group to learn from all of you, and also hopefully share with all of you the bigger, broader world of how this comptroller's perspective on helping all Marylanders prosper is something that we can embrace. I attended the Longevity Ready Maryland workshop, and I was so excited about the work that you're planning to do. And I'm very happy to be included and to have the comptroller's world included in this effort. And I'm just thrilled to be here.
Thanks, Mary. Mary was my partner. We did a shred it down in Ocean Pines way back when. And so she and I just ran the parking lot. So nice to have you. Nice to see you again, Mary.
Thank you.
Thank you, Mary. Let's hear from Meg.
Hi, everyone. I am Executive Director of the Maryland Regional Direct Services Collaborative. We're a coalition of individuals and organizations that work to improve job quality for direct care and services workers in the Maryland region. I am very happy to be here. I've been working in the aging services field, or AgeLand, as I like to call it sometimes, for about 24 years. And I've concentrated my work for over the last 5 or 6 years on two separate but very related topics. One is workforce, direct care workforce, and ageism. Happy to be here.
Thank you. We're very happy to have you. Let's hear from Monica.
Yes, hi. I'm also extremely excited to be part of this work group, especially because as a health psychologist and gerontologist, and by the way, I took advantage of the University of Maryland's Golden Passport program to get that doctoral certificate in gerontology. But I'm keenly interested in how individuals and organizations thrive in this 21st century longevity economy. And I'm, after consulting and working in both the public and private sector, I'm on my encore career, or in my encore career. And currently, my work with the Age Friendly Institute is expanding the number of employers who actually gain the distinction of being certified as age-friendly employers. And that's based on 12 recruiting and employment practices and policies that they must demonstrate. So Maine and Massachusetts is part of this program. There are a number of counties and AAAs that have this designation, and I'm hoping that Maryland gets it as well. In addition to this work at the county level, I live in Montgomery County. I was with the Commission of Aging for 6 years, where I'm still working to lead an effort to bring a position of senior fellows. You know, how do we really promote the experience and talents of the 50 plus to make a difference in county initiatives and county government. I'm also part of, with Kathy, actually, that you've heard of, the WHO AARP Age Friendly initiative, specifically the employment domain work group. So we have 3 objectives, and I'm sure we'll be, sharing that resource as well. And then I'm also a member of the Encore Network's Over 50 Employment Affinity Group, and we've put together a publication, An Employer's Guide to Engaging Older Workers. So I really come to this initiative with the to promote that employers need to be part of this conversation. We have employers who are looking for talent, and there's a great talent shortage. We have job seekers who are facing ageism, and we need to create bridges that really show the merit, the experience, the talent of the 50-plus worker. And it's not only for us who are in this age group, who are really experiencing for the first time this extra, hopefully 2 to 3 decades of living, but it's really creating these pathways for future generations so that when, the traditional retirement years are sort of out the window, but they can look forward to using and contributing their assets to making the economy of the state richer, and that they can be purposeful, not only and thrive economically, but also socially. So.
Lovely. Thank you. Welcome, Monica.
Thank you, Monica. Let's hear from Nancy.
Good morning. Hi, I'm Nancy Diamond, and most of my career has been spent in higher education as a faculty member and administrator, and most recently I was a search consultant. So, of course, I'm really interested in the multi-generational workforce, and I was particularly interested in what Monica was saying, and I hope you can share some of that material with us. Right now, I'm working on continuing education for adults at Johns Hopkins University and Notre Dame of Maryland University. And so I'm very interested in civic education and getting the word out. But primarily, my interest is on countering ageism through reframing the way that we speak about ageism. And really, just how do we talk about it? What language can we use? How can we, and I think that will apply to everything that we're doing here. If you really start paying attention to the conversation, there's so much that can be changed in terms of the language that we use. So I'm delighted to be part of this group, and I look forward to working with everybody.
Thank you, Nancy. We are very delighted to have you with us. Let's hear from Rosalie.
I'm Rosalie Kosloff. I've worked for the state of Maryland for about 31 years. One of my major jobs was as division director for Medicaid in the health department. And of course, we dealt with a lot of older people working with Medicaid. I currently teach across a number of counties with the local departments of aging. I teach chronic disease and diabetes workshops with older people. I have been doing this for at least 10 years already. And I'm here because I'd like to see more resources and work opportunities for older people. I think that's important, and a lot of what I'm hearing here sort of goes with a lot of my thoughts. I'm also thinking it would be nice to teach young people at early ages what aging is, so that they grow up feeling a lot more tolerant of older people and interested in working with older people.
Thank you so much, Rosalie. It's wonderful to have you. Let's hear from Sharon.
Good morning, everyone. I'm Sharon Ward. I am with Baltimore Alliance for Careers in Healthcare, or better known as BOC. Let's see, my background is in education, training, and coaching and advocacy. And at BOC, I'm the program manager for our adult pre-employment training tracks, as well as our youth immersions programs. So I'm at two opposite ends of the spectrum, working to kind of bridge those gaps around the coordination of our CNA, GNA, workforce training and education opportunities. And I am here today because I am very interested in learning more about the long-term services that are provided, and how the aging population, the treatment, the quality of those that we are training to put into the workforce and how that relates to the quality of care for those who receive those long-term services, and to learn more so that I can better advocate and coach for the workforce and those who are in the healthcare professions. And so I too am excited to be here and look forward to working with each and every one of you in some capacity.
Same here, Sharon. We're very excited to have you with us as well. Let's hear from Teresa.
Oh, my name is, can you hear me?
Yes.
Great. Last time I had some problems with my audio. My name is Teresa Roberts, and I chair the Maryland Commission on Caregiving. I also founded Hope for the Maryland Caregiver, and my goal is to see people, see individuals identify as family caregiver and to raise awareness about their needs and to connect them with resources throughout the state of Maryland. I live in Elkridge, Maryland, and I'm happy to be here.
Thank you, Teresa. And one last person, I have somebody with the name A Homemade Plan. I'm so sorry, I don't know your name.
No worries. Yes, that isn't my name. My name is Kenny Stott, and I'm a business development manager with a Homemade Plan, and we're a home care agency based out of Annapolis, but our services cover most of Southern Maryland and Central Maryland. And one of the main reasons I want to join this group, besides kind of being in the industry, is that I spent some time being a family caregiver for my grandmother when the COVID-19 pandemic hit. And I just kind of, that opened my eyes to the issues that older adults face in Maryland and just the US in general. And I just want to join help out in the best ways I can, and also learn from everyone else in the group.
Lovely. Thank you so much. And I think that is everybody.
Did we miss anybody that might have come in that hadn't introduced yourself?
No, I think Heidi joined, but then she left. I do not see her in the meeting anymore.
Okay, great. Well, I mean, it's so nice to meet everyone, and I think we can all be very excited. We certainly do have the gambit of expertise here. Y'all are certainly going to make my job easier, so thank you very much on that one. I think we all have a passion to this. There's been so much work done already, and so bringing it into Longevity Ready Maryland and sitting with such a fantastic, brilliant group of people, it's just really, really an honor to be with you guys and a pleasure. So thank you, thank you, thank you. With that, we are going to move on to, let me try to reframe Longevity Ready Maryland and what and where we all sit within the scope, because as I said, we are a good state agency that likes to overcomplicate things. So we've made a simple thing very complicated. So I'm gonna try to explain it a little bit better about where we exactly sit. And Julia, I think you are with me still, right? Do you have anything you want to put on the screen as a visual? Says I'm talking through Longevity Ready Maryland.
Pulling it up now.
There you go. Okay. So a lot of people have asked, and I'll kind of just start off. And so some of this is going to be such a repeat for you guys, and I apologize, but for those who haven't, when our secretary Roque came to Department of Aging about 18 months ago, she came directly out of the aging field. She, like me, had worked in senior housing for 30 some years. And, the whole story goes is that Governor Moore kind of looked at her and said, okay, what are we going to do over the next 10 or 15 years to be prepared? And she's like, well, okay. So that's kind of how this whole thing started, is that as the Maryland Department of Aging agency, we are a grant management, funds funnel through us, and then we grant them out to our local AAAs that put them into our communities for services. And so much of our focus as an agency was on grant management. We kind of didn't or forgot, and then COVID really got in the way of planning. And we had to be an agency of vision, and we had to figure out how to do both. both grant management and vision, and preparing for more older Marylanders. And I will say, I heard a lot about, combating ageism. So we are going to try to drop the word senior out of our vocabulary, because it's been noted that people would rather be called older than a senior. So it's hard, right? But that starts with that. So we put together, we got the executive order on doing Longevity Ready Maryland, which is we got to start a plan, not the solution, but the start of a plan. And there's so many commissions going. So many of you guys already sit on something. You've been working on this. I have had a lot of people say, why would I join? Because I love it. I love talking about it, but we're not getting anything done. And I get it. I've been on commissions. I've been on direct workforce commissions for the last 3 governors. And we've been talking about workforce for a long time. We have made some strides, but we haven't solved it. I contend we might not ever solve it, but it's because new problems come up, right? So we put Longevity Ready Maryland together. We kind of got started. It got to snowballing. It got a little out of control, which is why we paused a little bit. But we kind of developed it and trying to break it down into something manageable. And if you've ever heard Secretary Roque talk, she'll say, if you haven't, you will hear this. And she said, it's like eating an elephant. It's one bite at a time, right? And so we have 4 work groups. And don't get too caught up in the title, because a lot of us are like, where did this title come from? But it was there, and we'd already created some collateral, so we left it. So you've got the longevity ecosystem, you got our group, you've got the affording longevity, and you've got the health. You can see the recommended priority areas. I will just say, when you applied to come in with Longevity Ready Maryland, you were selected for what we thought your interests were and put you in the promoting economics, which is family caregiving, direct caregiver workforce, and then employment for 50 plus, which includes multi-generational grandparents, not only working, but being caregivers. It's not just the sandwich generation we have to talk about anymore. We got the grandparents that we have to talk about. I will just say, if anyone sees another group that speaks to you and your passion is just more served, you can move. I don't want you to, and we want you to stay here. And it all overlaps for sure, but we certainly want everyone to know, we want you to go where you feel most comfortable. We had about 250 applications, so we did our best to kind of put people into the work groups. So on with that, is there a timeline after that, Julia? We have more documents than we know what to do with, and it confuses the heck out of us. So with that, we are the Promoting Economics work group. There is a SAG work group. I'm going to kind of use a visual. They're kind of up here. And what I mean by the SAG, some people in this work group right here are in the SAG also. SAG are stakeholders across the state that meet opposite weeks of our groups. Some of you guys might be on both of them, but the stakeholders are more about, there you go. So the stakeholders are more about the people that are within the state that once a decision is made or a suggestion is made, let me say such suggestion, not decision, but a suggestion from a work group, that it goes to the Stakeholders Advisory Group, SAG, that's what we're talking about. It goes to them, and these are the real movers and the shakers within the state. And they're the ones who we, need to buy in. Are we on the right path? Is this in contrast to something that's going on within Maryland that could complement and it continues to get traction? Or is it, not? So the SAG advisory group is another level. Again, some may be on it and some may not. You may be on both of them, in which case you got these 4 meetings and then you got those 4 meetings. But if you are not on it, it is a public meeting and you can always access it to watch it. So just to kind of know, we are the work group and the work group members. We have our chair, which is Mavish. We do have the stakeholder advisory group. And then there is the cabinet advisory. The cabinet are the secretaries, the Secretary of Transportation and Human Services and Education, because ultimately a lot of what we are going to be suggesting is is going to have buy-in from other departments. We actually put that in a strategy of if it's a particular strategy, how many other departments are going to have to be involved in that? Obviously, when we're talking about labor, we're going to have the Department of Labor involved in that, education. So it then goes up to the cabinet advisory, and then ultimately we're the ones kind of managing all of that. So that just kind of explains the work group that we are on, and then the SAG, and then the cabinet level. So it gets to be there. We have a timeline that we've already had some meetings. We are starting our meeting. We will be done by November 8th. We have our 3 additional meetings already set up. One is next Tuesday. I apologize for piling 2 of them on so quickly. The reason we did that, and of course, then I had to even change from Tuesday to Thursday. The reason we did that is if we feel we need another meeting after our 4 to continue to get things together, I gave us a buffer of time at the end of this period. By November 9th, this is closed. Our chairs and our leads will then be working on transcribing everything and getting it into the actual formal plan. But we do have some time between our last meeting and November 9th that if we did need another one, we could. Now, in addition to our workforce, which is promoting economics, we are going to have some subgroups going on. We, in fact, already have one that's been working for quite a while, and I'm going to have Cheney talk about that on direct caregivers. And then we also have the Maryland Commission on Caregiving, who has been working on this too. And I'm going to have Teresa talk about that. So there are subgroups that are going to come out of just this one group here. So that, we can kind of keep our 4 areas, which again, direct workforce, family caregiver, economics. Yep, there you go. The 50 plus, and then grandparent generational. So we may come up with 3 work groups, but we make the subgroups. We may come up with 4. I'm going to kind of let the group determine on the multi-generational workforce and the employment for 50 plus. Does that need to be as 2 separate subgroups, or is that one subgroup? The direct caregiver and the family caregiver are already a subgroup, and some people are working on them, but you can join into those subgroups. So we are going to get our stuff together. We're going to have our subgroups. We do have a couple of meetings already set up for both of those that we're going to let you know about during today. And then we're just going to get down and we're going to start working. Ultimately, we want each subgroup to come up with 1 to 2 suggestions. We can call them goals. We can call them whatever we want. What we don't want to call it is a strategy, and I'll tell you why. We want each subgroup to come up with 1 or 2 suggestions. We'd like to keep our work group to about 4 or 5 tops. So every subgroup can't come up with 2, because then that's 8. You can just kind of take a look. If we had 8 suggestions over 4, we're now not just taking a bite of the elephant. It's getting really, really big. So we do kind of want to make this manageable to have a couple of suggestions. But then the big thing is, what are the strategies to get that goal done? If it is in caregiving to have, a training program for our family caregivers, we need to develop it. We need to work with it. So it comes under this. So a lot of the work, the actual where the rubber meets the road, is the strategy. So there's a lot more strategies to actually, here's how I would like to accomplish. Direct care force may be to increase caregivers by 5% by 2030. I don't know exactly what they've come up with. They've got a couple of things going. So that's what I talk about, is we'll come up with a 1 to 2 per subgroup, 4, no more than 4 to 5, maybe 6 at the top as a whole work group. And then a lot of strategies that we're putting together on how we're going to get this going and get this moving. So once we get all of our stuff done, and that will be done by November 9th, we will have picked out what are our goals for our groups and these subgroups, these areas. What are all of these strategies? There's going to be a lot of the busy work. We will put that into, and you can go back to the timeline, Julia, if you want. We're going to put that into a report, and then it takes us a little while where we're going to put it all together. But by December, we will be taking that entire report to the cabinet advisory. Obviously, again, a lot of crossover. After we kind of get their, buy-in, and then to get to see it, we are going to take this to the public. And we are going to do public comments. We've got 3 really large town halls scheduled. We've got 2 virtuals. In between now and then, we are doing a lot of smaller town hall groups. In fact, I'm going to one in Queen Anne's County, which I happen to live in Queen Anne's County, so I didn't have to go too far to work this afternoon. But we're doing a town hall on some other stuff, and we asked if we could come talk about longevity. So not just in January is the only time the public can do it. We've been out and probably have about 30 events that we are attending between now and then, that we are out and we're talking to the older Marylanders. That's a tremendous part of this whole plan. It's silly for us to plan it if we're not out there talking to them. Then the draft gets submitted for review. It has to go up to ACL, which is just a federal one. And then there it goes to the governor by July of 2025. And so that's just kind of our timeline. You can kind of think, oh, we got till July 2025, but you see there's so many steps in the middle, which is why our November, I said 9th, but I'm seeing the 15th. So sorry about that. November, well, they're not too far from each other, are they? 9th to the 15th is when we end. And then it looks like kind of a pause. But then that's kind of behind the work that gets done in the public there. And so, yes, ACL is administration for, what is it, Julia?
Community living.
There you go.
Yep.
Right. All these acronyms, boy, going from private to public. I've had to learn so many acronyms. It's crazy. So is there any questions about Longevity Ready Maryland, or conceptions that you had, or something that you've heard? I really want to make sure everyone is very comfortable on, where we lie within the Longevity Ready Maryland. Yes, Monica.
Yeah, Leslie, coming up with these 1 to 2 suggestions or goals, what about funding? Where does that fit in? Because we can have the greatest suggestions and goals, and then, those on top say, well, we don't have the funds. So is this program well funded, or will it be?
No, 0 funding to this particular program. But don't lose hope, Monica. Hold on. But you're 100% right. Nothing happens without funding. But if it is the subject matter experts across the state of Maryland, and it is the stakeholders' support of whatever that initiative is, and it is the cabinet members' support of, yes, we need to do this, that's when this goes to Annapolis. And we say, legislatures, you have to find a way to fund this. They are going to have to fund initiatives, or we will not be prepared for all of our elderly people, our older Marylanders in years to come. And they are very aware. Well, let me back off that statement. Some are very aware in Annapolis, but the governor and his administration is very aware. And if we don't put funds into funding things now, we're going to be much worse off in 10 years from now, because we're not going to be prepared. And if you're not prepared, guess who pays? The state. So there is very much a knowledge that funding, this has to come with funding, and that, this is going to, a lot of our suggestions are probably going to have to go through Annapolis. But this is the platform to get it into Annapolis. Find our supporters out there, find our senators that can support this and get it behind it. And that's where the funding would come, Monica. So, thanks. Kathy?
I was just going to ask, so is one of the most important things is the governor really supports our outcome, because it's got to come from the top down. It sounds like he's committed to that. Is that the case? Because I know the governor in Colorado has really driven an age-friendly community and has made huge strides. Is that something he's really looking towards?
He is. He 100% is. And this isn't, I certainly won't go down the political road on that one. But the fact that he signed an executive order that said, go put a plan together and put it on my desk, I could say would be political suicide if we put a plan on your desk that you ordered and then you didn't support it. So don't think that's going to happen. But he has said we have to be prepared because we're going to go bankrupt if we're not prepared when it comes to doing this. So he certainly understands the negative economics that this will be if we're not prepared. He also understands, especially in our group, the economic part of this is huge because we need to be a state. I think a lot of times people think that we need to be a state that retirees want to come to. Well, that would be great, except you're probably better off to maybe go to Delaware. And we don't want to, I'm not trying to push anybody out of Maryland, but how about being a state where seniors would like to come live because they could work? Now you're part of our growth. And so there's people have to, and I think this is where this administration is really looking very holistically around everything, that seniors have to be a part of the education. They have to be a part of the economics. And it's not all just the health care and how do we care for them, but they need to be a part of our, we need to be prepared for our society. So I have seen, and I'm very excited that this administration is very much behind. And I'll just share personally, it's why I left my private industry and I came, because Longevity Ready Maryland is something that's very exciting. And I have been on a lot of groups with people as we were kind of getting this rolling that have said, you know what, I'd love to be on your labor task force, but we have said this enough and I'm not going to say it. I said, but if you know, thank goodness people that changed the world didn't have that, because you can't make change unless you keep pushing and pushing. But maybe this is the platform to get it in. And so I do say I am very pleased and that this administration is supporting this and supporting the effort. And he asks every time he talks to the secretary, how's it going? So, you know, glad. I'm very pleased. So we're very, very, very optimistic. Not even cautiously optimistic. We're very optimistic that he's supporting it. It's a great comment there, Kathy, for sure.
I was born here and I'd like to stay here and be able to afford to do so. So it's as my friends are all retiring in Delaware and Florida, you know, it is, I think, important that we acknowledge that Maryland does need to become age ready, and work is, I mean, I'll drink the water. Work is such a big, important part of that if you choose to work and staying engaged in the community. So, yay.
Yeah, absolutely. Any more questions on Longevity Ready Maryland or subgroups or anything like that? Josephine.
Yes. Hi. Talking about the other states that are obviously a little more financially senior ready, Delaware and Florida.
Yep.
Are there groups such as LRM in those also that we can connect with and say, you know, get some ideas from, or you know, things like that?
Yes, there are. I'm gonna be honest, Josephine, I don't know which states. We've already done in probably the 12 months prior to this kickoff. There are a handful, I'm gonna say 10 states that are working on, we called it Longevity Ready Maryland, but they're working on, you know, multi-sector plans to prepare on how they get ready for aging. I know North Carolina is one because they have a really big boom coming with their population. Wisconsin is one that has really been noteworthy from a federal perspective, from a federal, I don't know why I said that word, national perspective. They've really done a really great job. I think someone said Colorado, it's another one. So yes, in the past, for the past 12 months, the team, I haven't been with them, but the team has met with them. They've worked a lot with them on how'd they get their plan started? How'd they get it? It's actually how they said, start with your governor. Governor's got to support the plan and get it going. I'm going to be honest, I don't think Delaware is one, being such a small state. But again, I think Delaware and Florida have a little bit different approach, that they want to be a retiree state. We want to be a state where our economics support people to be able to retire. We got to get ready for the economical part of it, and the wellness part of it, and the health part of it. So yes, that's out there, and we've been talking to a lot of them. So it's a great point.
Thank you.
All right. Well, if there are no more questions, I'm going to ask We do, as I kind of mentioned, have 2 work groups, subgroups going on already. One is our direct care workforce. And I have several of you guys are on that committee. Because you are on that subgroup, you are in our group here. But I'm going to ask if Cheney is still on, if Cheney could just kind of talk about that group or I don't know if Meg's going to do it or Chase. I don't know who's on here to do it, but one of y'all
I'm here.
kind of tell us what's going on and how's it going, and kind of some of the suggestions, and so to bring the rest of the group up to know all the work that you guys have been doing, because I was in a meeting earlier this week, and it's a fabulous group, just fabulous group. So thank you for leading that.
Wonderful. Thank you. I'm here and I can give updates. And if I miss anything, Meg or Chase, please fill in any gaps. But thank you again, Leslie, for allowing us to share. I don't know that I have 10 minutes worth of an update, so I'll probably save us
that's all right.
time.
That's fine.
But we are a group of about 13 or so folks. We have been meeting, focusing on issues related to the direct care workforce. I think our first meeting was back in June. And so we consist of researchers. Our group includes some community organizers. We have representation from the Hilltop Institute. We have representation from the Maryland National Capital Home Care Association and the Maryland Regional Direct Services Collaboration. We have a couple of providers on, and we have invited direct care workers to join our group. The challenge is we meet during the day when most people are at work, so it does make it challenging, but we do have some ideas for how to incorporate them and their feedback and participation in any recommendations that we put forth that would result in any changes that they experience on the ground. And so I will say that, we acknowledge that the direct care workforce crisis is a national crisis, right? Maryland is not unique in the challenges that we face concerning turnover, wages, and so on and so forth related to the direct care workforce. Fortunately, there are several of us that have been doing work in this area for a few years, so we do have a good understanding of what states are doing, other states are doing to help improve the direct care workforce. So we've met 3 times over the summer. As Leslie stated, the last meeting was the other day, and we went through a very good exercise of narrowing. We had narrowed down, and I'll talk about some of the issues that have risen to the top, but we had narrowed down our primary issues that are impacting, we believe, the direct care workforce in Maryland to like 4 buckets, 4 domains. And we spent some time brainstorming strategies for how we might address each of those. And so the 4 areas of interest that have risen to the top include first, income and wages for the direct care workforce. And again, these are direct care workers both in facilities and outside, providing home and community-based services, so on. So income and wages. Improving state reporting and data collection is the second. The third is the need for a direct care workforce registry. And the 4th is related to retention and recruitment. And so we broke out into 4 breakout groups or breakout rooms in our Zoom meeting. And we spent some time brainstorming, just putting pen to paper on some strategies for how to address each of those 4 areas. And so the next step is to condense it even more, because we are also challenged with 1 or 2 recommendations. And so part of that next step will include, and this, I really have to shout out Meg for her continuing to advocate for the voice of direct care workers in our group, is engaging direct care workers to get their feedback or their thoughts on the work that we have done so far. We have students at Hopkins who are going to be helping assemble the writing of the recommendations, but also with engaging direct care workers. And so that's sort of where we are right now. So as Leslie said, we are more than happy to engage others that are interested on this group, that are part of this broader group. We will probably more than likely meet one more time, at least next month, so that we can all get on the same page. But a lot of our correspondence in the coming weeks will be via email. So happy to engage any of you. I can put my email in the chat and we can go from there.
Great. Excellent. And I am going to talk about how people can kind of get into these subgroups that we're doing. I do think we also have opportunity probably next Tuesday is to maybe divide us up into subgroups and we'll do some breakouts. And those, we're going to ask you guys at the end of this one to send us an email on which subgroup you'd like to be a part of if you have any strong feeling that way. But so not only with the meeting that Cheney to talk about they still have, but we'll be able to talk about these things as a large group too, and doing some breakout groups and take this time because we've all got our own jobs, right? And so we can't keep throwing meetings on everyone's calendar. So together we will get it. So thank you, Cheney. And thanks for all the work you did. And Chase, you just did a fabulous job. That was Tuesday was just actually fun. JJ and I just talked about it. We both kind of came in and said, okay, she's got to do all of our stuff from now on. Chase, you did great. So,
Chase was amazing.
Thank you so much. And if anyone has any, questions or anything about, organizing some of this stuff, happy to chat. I love that stuff. So love it. Thank you so much.
Well, you were very good at it. So I also wanted to have Teresa, and she and I are becoming best friends. I think she and I are talking like weekly now. And poor thing's been on vacation. I keep bugging her. I was like, wait a minute, answer me this. But Teresa is in charge of the Maryland Commission on Caregiving. And I'm on that as a Department of Aging representative. And so I'm learning a lot about how that commission even got into existence. So I wanted her to kind of talk about that for anyone who may not know about that commission. But I kind of thought instead of using our group as a subcommittee, this is a committee that's been working on family caregiver related issues. Why would we do something that competes? And this is kind of goes back to what I had said, that a lot of this work has been done or has been talked about. We don't need to reinvent the wheel. We need to bring together all of the efforts that have happened over the last years with reports or commissions or even notes of groups that you guys have been on, and let's get this all together and let's get it in this plan. But I'd ask Teresa if she could just explain the Maryland Commission on Caregiving and its existence and how it works, and then maybe talk a little bit. She's done a little bit of the subcommittee, and then we paused a little bit, but she can kind of talk to you also about the subcommittee within this group that she's kind of working through her Maryland Commission on Caregiving. So.
Wonderful. Thank you, Leslie. As she stated, I chair the Maryland Commission on Caregiving. I was actually a family caregiver for more than 25 years to my husband, and I didn't identify as a caregiver until about maybe 6 years ago. I was introduced to the commission 4 years ago, and my life has never been the same. So I'm excited to share a little bit about the group. The Commission on Caregiving was established in 2001. It's mandated through the governor's office, and most of our members are state agencies like DHS, DOA, DOH, and the VA, Easter Seals. We have some vendor partners again, Easter Seals, AARP, and of course, informal caregivers. And the commission itself was charged with identifying the needs and the challenges that are faced by family caregivers. And and what's more importantly, is across the lifespan. And so the purpose of the commission is to advocate for and empower caregivers and make recommendations for effective public policies and the coordination of services. And you'll find this information on our website. We were, the idea came to us about Longevity Ready Maryland back in, I think, April or May. We formed a small subgroup after that meeting, and we've had maybe about 3 or 4 meetings since then and done a little bit of work around this topic. And I'm just happy to be here today. So if you have any questions about the commission, it's open to the public. Anyone is welcome to join. And we are planning to meet again twice in the month of October, but Leslie will tell you more about that later. How did I do?
That you did wonderful. You did perfect. It's a great commission. It does have the support of a couple of senators and delegates. I will say that for those who may not be aware, but in the last legislation, there was a bill put forth for family caregivers. The bill started off as a tax credit, which has been adopted by about 5 states, that there would be a tax credit because we know we have child tax credit. That's actually national. And there's a big push to have a caregiver tax credit. the bill got flipped upside down and it turned into a kind of a voucher payment kind of bill. And everyone got pretty excited about it. What people missed was the really key word that said it was approved, it got passed, but it came out of discretionary funds. And I don't know of those who know too much about policy, but whenever you see a bill that is going to be funded with discretionary funds, you should just automatically know that means there's no money. So, but a lot of bills pass that don't get funded right away, and they have to go again and again. I will say Wisconsin, Colorado passed theirs, and I think they said it took about 8 rounds to go through. So, you know, I think this is something that the Commission on Caregiving was very supportive behind. There certainly were several, Senator Benson was behind it. There's several senators and delegates that were behind it. Very disappointed when it came out that it passed, but it wasn't funded. But it was a start. I think the tax credit is probably going to come back around. I think this is something this subgroup needs to talk about if it's something that we want to push. You know, so there's a lot of opportunities. I will just say family caregiving is becoming quickly one of the biggest buzzwords when it comes to older Americans, because it's a huge part of the formula, not just direct workforce, but caregiving. And as Teresa said, there's so many caregivers that aren't even classifying themselves as caregivers because they're just the daughter. And so we have to change the words to let people know that you are still a caregiver and you're part of that care team. So there's a huge education that needs to come with family caregiving too. So really excited to continue to work with the Commission on Caregiving on that one. With our 15 minutes left, I wanted to, let's see, am I missing anything? I wanted to talk, all right, we're good on time. I wanted to talk about, does anybody have any comments or strong feelings on where are steps we need to make? I know that is such a broad question out there, but what I want to do is kind of put that to you, that if you don't have an answer now, we're thinking about that on Tuesday so that we can get to working. We do have the 2 subcommittees going. We are going to need a subcommittee for the 50+ workforce group. So my ask is there anyone who would like to chair, like Cheney and Teresa, a subgroup for our workforce groups of 50+? Think about it. If anybody wants to raise their hand quickly, that'd be great. If not, if you can think if you could have the bandwidth. Oh, Kathy, are you raising your hand to do it?
Yes, because I think it's so important.
Oh, good.
And it really needs, I mean, it really needs to come from the state down, because we're not, as Monica said, we're working on the local level and we are just not getting where we need to be. And it's such an important topic. But I do think, to go back to your point, I do think the intergenerational and the 50+ needs to be together, because honestly, we can't do it without, the youngers can't do it without the olders, and the olders can't do it without the youngers. And you all can set that bar wherever you want it to be, but it's, we're all in it together because we're all future old people.
Yes, that'd be great. And so Bisme, I see a couple of people wanting to do that. So that would be great. Kathy, you're hired. And I was kind of hoping when I saw, I knew of you. So I was like, but I think that's an important work group, and they all really do work so well together. So my next ask is, we have dates, and Teresa has dates for the family caregiver. Cheney has the date for direct caregiver. We now will have our subgroup for the workforce, 50+ workforce. And we'll work on dates with that. And Kathy, Julia, and I will be here and Mavish to help you on, to give you a lot of support on that one. What I would like everyone to do is, if you would email Julia and myself and Mavish, you can put us all 3, but at least Julia, on which subgroup you would like to sit on. We want to make sure you guys get your own separate insight of what that subgroup is and when the dates are. We do have, like I said, we've got one set for Cheney's direct workforce, but I do think we're going to use this time also to talk about that. And we'll do breakout rooms on Tuesday to do this. Teresa has 2 dates. I think it's October 1st and 15th, Teresa, I think.
Correct.
Yeah, 1st and 15th on that one. And then we'll work on getting a couple of dates for Kathy's subgroup on that one. But if you would email Julia which subgroup you would like to be on, we can get ourselves very organized between now and Tuesday, and we'll work in breakout groups and kind of get anybody who has not been a part of the subgroup started. And also then the workforce group of 50 plus and multi-generational can kind of get started on what we want to do. And then that makes Tuesday become a real working meeting. Today was more of a let's understand what we're doing and get to meet everybody, but we can really start working on Tuesday. Monica, yes.
Yeah, so what Kathy mentioned as far as combining the two, the multi-generational workforce and the employment, I concur, and I think we should do that. So
Yeah,
that
I think
way,
that's great.
we could maybe come up with 3 instead of
Look at you trying to, I see what you're trying to do. I'm good with that. Listen,
Also, yeah, go ahead.
Well, I was just going to say, I believe that our workforce group and the longevity workforce group, and if you look at that within Longevity Ready Maryland, the longevity has to do with housing and healthcare. I think our 2 work groups are the biggest part of Longevity Ready Maryland. It is all important. Health and wellness is important. Social isolation, all of this has to be a part of it. But the caregiving and workforce and housing, I don't think anybody would disagree that those are the 2, really large things in front of us that have to be talked about, that we get a little bit more prepared. So it's going to be almost impossible to come up with, just a couple of suggestions. We got a lot that we need to be working on, Monica. So I'm with you on that one, and I'm going to push. So we're in good shape.
Also, I just have one comment. You said that we're going to develop these suggestions. It's going to go up to the line to the stakeholders. It's going to go up to the line to get some sponsors and so forth. But as we all know, if we get participation at this early stage, then they're more involved in it, as well as they're going to promote it. Are there any legislators now that we know who are really, gung-ho, and that we could at least, sort of inform them or have them somewhat a part of this?
Yeah, so the answer is yes. The reality is the timeline has eluded us. So there is no doubt Longevity Ready Maryland should have been kicked off in January of this year so that we could, because when you're going to, and again, I'm not a legislative person, but I've been around it a lot. If you're going to influence legislation, you got to get in there in the fall, because the fall is when you start to influence them to get them ready of what they're going to do and what bills they're going to put forth come January. So we're a little bit behind the 8 ball. I will say the deadline has come and passed for anybody to put in a bill, and no state agency that I'm aware of, I think I heard that correctly, but I'm pretty sure no state agency put a bill in. Maryland Department of Aging did not put a bill in, and nor would we. We don't really have the bandwidth to support a bill. All that to be said, 100%, we know that there are some things that are going to be suggested that need to get some traction for this upcoming legislature, because we can't wait until 2026. I think that the family caregiver tax credit is probably one that's probably going to rise to it. I think, direct workforce, and I think the 50 plus work group fits right into one of the governor's 10-step plan is to grow our economy. You will grow the economy if you grow our workforce within our older Marylanders. So he is going to be very receptive to hearing suggestions. And I think legislatures are going to be very much to want to jump on the bandwagon to take on some of these things. So no, we absolutely are not going to wait till all this gets done to talk to Annapolis. As things get going, and if we see something have some traction, We have MDOA has its own legislatures. You guys have, you guys have your connections out there. We can absolutely and plan to talk to people that, that things might start getting pushed now. Absolutely. We can't wait. We can't lose this particular go round of the legislature to move some policies, because a lot of this is going to be about policy. I absolutely agree. So, Karen, you had a question?
I just wanted to put this out there because I'm not sure which work group I may end up on, but something that we have noted, Leslie, we've been doing a tremendous amount of work in senior housing and also in communities that are highly populated by seniors that are low income. And one of the things that we see that makes all the difference, which I think is a combined workforce and caregiver issue, and housing issue, is that the properties where there is a service coordinator, that makes such a difference in quality of life for the people that reside in that building. Because otherwise you're working with a property manager who's really there to deal with logistical issues of property management, not so much to provide supports in terms of light casework kind of things, and identifying needs and connecting people to services. So I just wanted to put that out there as something that makes a massive difference in quality of life and connecting to resources for individuals that live in senior housing complexes. To not be forgotten. I know we're talking about workforce and we're talking about in-home care providers and staff for assisted living facilities and casework members, but that I think is something that could easily get forgotten. And I just wanted to put that out there as a thought.
No, it's a great comment. I got like 10 things just came to me, Karen. So we'll continue to talk about that. I was just at one in Hyattsville, and they did not have that, and they talked about it got cut, and the residents themselves talked about how life had changed since that position, and this was a HUD housing. So that's within our preview, right? So it's a great comment. Thank you, Karen. Diane.
Yeah, I was just thinking about something Monica said, and I'm wondering if it might be possible. I know we've got a really short window here, but even thinking about advocates in the legislature for these work groups, I'm thinking of Cherie Temper Hughes on the Eastern Shore, the pro tem, I think she is. Whenever I do a program on the Eastern Shore, we always invite her as our keynote speaker, and she was a caregiver. I think she may still be a caregiver, and I'm just thinking, maybe there's a legislative aide from her office that could serve on this committee as well, that can then report back out to her. And then I'm thinking about the other work groups, and I don't know enough about who our legislators are to know, what their interests may be, but just even reaching out to different offices. I'm thinking there was a Montgomery County that was interested in workforce development, and maybe there's somebody from his office that we could reach out to and see if there may be somebody who could serve on one of the work groups or sit on one of the work groups, if nothing else. I mean, they don't have to contribute, but to take that information back to their,
I absolutely love it. And I've actually attended for her, and her sister and I have worked on some things together. So I actually will email them. That's a great idea. And I love that. So if anyone has a thought on that one, I would be more than willing to do the legwork to, like you said, at least get an aid into these subgroups. And there's where you capture their, so that's a wonderful idea. Elizabeth?
Thank you. I just wanted to follow up on Diane's great idea. Is that also I just met with Chair Gazzoni last week, who's the chair of the Budget and Tax in the Senate. I think having that voice at the table as well, not just, most of the legislators nowadays are family caregivers. The chair of the Senate Finance Committee, also a family caregiver. I mean, we have a lot of resources, but I would target the budget and tax primarily because if you're going to target the tax credit issue, I would have buy-in from that committee, number one. It'll make it a lot smoother and have their voice at the table at this stage.
Yeah, well, they weren't supportive of the first go round, but yes, they're the ones we got to keep hammering to. But it wasn't our bill, but yes, they're the ones.
Right, but they were looking at budget deficit. Which,
Yeah, no, you're right. Well, I mean, I think it's
a little better.
Yeah, it's kind of known that, and this again is not a Republican. It's just a Republican is much better to give tax credits. Democrats don't typically give tax credits. Doesn't mean it doesn't happen, but because it comes down to a budget issue and revenue. So yeah, I think Monica, you were next.
Yeah. So I know, there's the governor's workforce development board, and, our employers in the state sit on that and they talk about all this stuff. That would be, if we could get somebody or some participation, because this is really going to come down to employers buying into this and seeing the value and, being creative in terms of this whole effort. So I'd love to see an employer be part of this, as well as, I know we have Department of Labor, but, that's where we would really, I think, benefit.
Yeah, it's absolutely correct. And that's a great comment. I believe that there's at least one, if not two, but you're prompting me to think about it, that are on that workforce group that are in the SAG.
Okay.
And we're kind of picked because they've already done some work and they've got the ear of the governor. But let me double check that one. I'm glad you said it, but I'm almost positive. But I want to, and I'll let everyone know. But that you're right. They're a good end for all of this for sure.
Yeah, and I'd be happy to help with pursuing that.
Excellent. Thank you, Monica. Karen?
I just wanted to echo the comment that was made about Senator Gazzoni. He has been a tremendous advocate and support for the AAA network, and our lobbyist has worked with him, and he is well educated about senior care and has taken time out of his schedule to talk with our network in years past. So I just want to second that comment that I think he is well-versed and educated and would be a great ally to continue to talk to.
That's great. Karen, I might call on you and maybe we can tag team some ideas on that one. So I've got it written down. That's a great suggestion.
And also our lobbyist with M4A would be great, Ann Cott.
Yes. So perfect. Love it. Nancy.
Yeah, I'm wondering if even if we could not get someone to participate in the work groups, could we have somebody that is being mentioned now address the group? At least we get an involvement there and they know about us. But I think that might even be useful to have somebody talk to our whole group and see, what questions we can get answered.
Yeah, no, that's another great suggestion. So excellent suggestions, everyone. Guys, we're up to our 12 o'clock. An hour and a half goes quickly. I'm so delighted and honored to be working with all of you guys. And this is going to be a really fun group. We're going to get a lot of stuff done. So thank you for your commitment to this and for joining us. If you cannot access the work packet, there's nothing I can do for you. I don't know how it works. And Julia and JJ are much better at it than I am. Like we said, it's kind of an access thing, but we would like to, if you could try to access the work packet, everyone should have some sort of permission to do it. But if not, please email Julia. I think some of y'all have. Within that packet is just more defined longevity ready Maryland stuff, but also a ton. And when I say a ton, probably 50 different links to reports and or commissions or work that is being done or has been done in the past that you could probably drive yourself crazy reading, but a lot of stuff that you guys have probably been a part of. It's just continued resources so that we're really well-rounded in bringing everything to our groups. We're as prepared as we can. So I just want to invite you to, continue to play around with that. We will be putting out an agenda for Tuesday, tomorrow. If everyone would email us which subgroup you would like to be on, we will get started working next Tuesday. And if there is nothing else, I'm going to wish everyone an absolutely wonderful Thursday. Have a wonderful weekend. And